Inside your body, right this very second, there are countless perfectly timed events, all working together just to keep you going. But what happens if you pull one single crucial piece out of that system? Well, today, we're going to dive into a pretty high-stakes story, a body's desperate fight for fuel when the one key it needs to survive suddenly goes missing.
Okay, let's kick things off with a real-world scenario. Imagine a person with type 1 diabetes hasn't taken their insulin for 3 whole days. What is going on inside their body? What are the signs you'd actually see on the outside that would point to this massive internal crisis? Just hang on to that question, because by the time we're done here, you are going to know the answer cold.
So, to really get this, we first have to talk about the hero of our story, insulin. The easiest way to think about insulin is like a key. Its entire job, its whole purpose, is to unlock the doors on our body's cells. Why? To let glucose, sugar, get inside so the cells can use it for energy. Simple as that. No key, no entry. The fuel can't get in.
Right, so when there's no insulin to open those cell doors, all that sugar just gets stuck. It's got nowhere to go, so it ends up just floating around in the bloodstream. And this creates a massive biological traffic jam. That traffic jam is our very first problem. It's called hyperglycemia. The name says it all, really. Hyper means high, and glycemia is about glucose in the blood. So literally, you've got way too much sugar in your blood.
Now, this first problem kicks off a really dangerous chain reaction, a kind of domino effect, called diabetic ketoacidosis, or DKA for short. It's a cascade. It starts with no insulin, which means sugar gets trapped in the blood. Then, the body tries to flush all that sugar out, but the cells are still starving, so the body starts burning fat instead. And that creates an even bigger, more dangerous problem. The blood itself starts to become acidic. Let's walk through this whole thing, step by step. So just try to picture this for a second. You've got all these cells, and they are literally screaming for energy. They're starving. But right outside their locked doors, in the bloodstream, there's this huge abundance of fuel just floating by, totally useless to them. It's this wild paradox, right? Starvation and a sea of plenty.
Okay, so the body isn't stupid. It knows these super high sugar levels are a major problem, and it tries to fix it. Its solution? It tries to dump all that extra sugar through the kidneys. This whole process is called osmotic diuresis, which is basically a fancy way of saying the body is desperately trying to pee out all the excess sugar. But, and this is a huge but, where sugar goes, water has to follow. And I mean a lot of water.
And all that flushing leads to some really serious dehydration. We're not just talking about feeling a little thirsty here. We're talking about major clinical signs you can actually see. The heart starts beating way faster. That's tachycardia, because it's trying to make up for the low fluid levels. The skin gets warm and dry, it loses its normal bounce back, and the inside of your mouth and nose get all dry.
All right, so let's recap where we are. The body tried to fix the sugar problem, but in the process, it created a massive dehydration problem. And worse, the original issue is still there. The cells are still starving. Their main fuel is still locked out. So what does the body do now? It's got to switch to a pretty desperate plan B. And here it is, plan B. The body basically says, fine, if I can't get to the sugar, I'm going to start burning fat. And it starts breaking down its fat stores like crazy, just trying to get some kind of energy to those starving cells. I mean, on the surface, that sounds like a pretty smart workaround, right? But this backup fuel, it comes with a really toxic side effect.
This is exactly where the name ketoacidosis comes from. See, when your body burns all that fat for energy, it creates these byproducts called ketones. Now, a few ketones here and there are no big deal, but in this emergency state, the body is cranking them out so fast that they build up and make the blood dangerously acidic. That's ketoacidosis.
So now the body is facing its most dangerous problem yet. Its own blood chemistry has turned acidic, which is a massive threat to life. It has one last, desperate defense mechanism it can use to try and fix this, and it's a powerful one that involves your lungs.
The body literally tries to breathe off the acid. The respiratory system goes into total overdrive, and it triggers this very, very specific breathing pattern, super deep and super fast breaths. Now, this isn't someone who's struggling for air. This is the body's automatic, frantic attempt to blow off as much carbon dioxide as it can because that helps lower the acid level in the blood. And this unique pattern has a name. It's called Kussmaul breathing. And that brings us all the way back to our first question. What would you expect to see in that person who missed their insulin? You'd see these classic telltale signs of DKA. You'd see the signs of dehydration, that warm, dry skin. And you'd see the body's last-ditch effort to fix the acid problem, that deep, rapid Kussmaul breathing. Every single sign tells a part of the story we just walked through.
You know, one of the best ways to really lock in your understanding of something is to look at its complete opposite. So to really get what happens when there's too little insulin, it's super helpful to look at what happens when there's too much. That condition is called hypoglycemia, and it's pretty much the mirror image of DKA.
And man, the contrast is really stark. DKA is caused by too little insulin, hypoglycemia, too much insulin. And that core difference leads to totally opposite signs. So instead of that deep, rapid breathing to blow off acid, you get rapid, shallow breathing. And instead of that warm, dry skin from dehydration, with hypoglycemia you see cool, pale, and clammy skin. Seeing them side by side just makes the why behind all the DKA symptoms that much clearer. So after going through this entire crazy chain reaction, what's the big takeaway? It's that insulin isn't just about blood sugar. It is the master key that stops this whole life-threatening cascade before it can even start. It prevents the sugar traffic jam, which prevents the dehydration, which means the body never has to switch to burning fat, which means the blood never turns acidic. Its presence is what keeps everything in balance.
And that kind of leaves us with one last thing to think about. We just pulled apart this one incredible, complex, and dangerous chain reaction that our body manages. It really makes you wonder, doesn't it? What other silent, high-stakes ballets of chemistry and biology are our bodies performing every single second of the day just to keep us going?